Aloha, my name is Hope Young, and I am the Advanced Care Planning Coordinator for Kokua Mau. We're here talking story today about advanced care planning. So we do like humor, and unfortunately the font for this is a little bit blurry, so communicating with dead people is easy, but communicating with live people is hard. And I tend to agree. So I'm with Kokua Mau. We are a nonprofit organization. We are a 501c3 community benefit organization, and we're statewide. We have members that support us in the work that we do. Our members consist of health plans, hospices, long-term care organizations. We have churches, we have temples, we have all types of organizations out there, as well as individuals who see the value in the work that we do. And so they support us through their membership. I've been lucky enough to work with members that are passionate volunteers. We call them our ambassadors. Our ambassadors include social workers, nurses. I even have a few doctors that they volunteer their time to come and do these presentations out in the community. And so we're fortunate to work with people who are passionate about our work. Our three areas of activity is that we work with people who may be facing serious illness and their loved ones so that they understand what kind of decisions they may be faced with early. And we provide networking. So we go out there in the community and we train professionals to have these conversations out in whatever setting they're in. We also change the system through policy and legislation, and we'll talk a little bit more about that later. But we like to say we're leading a movement. Our movement aims to make advanced care planning and open communication about care and support for those with serious illness a cultural norm. We want people to be talking about this while they're healthy rather than waiting until an illness or a diagnosis. We want them to start having these conversations sooner rather than later so that they're not in the middle of a crisis trying to make decisions. Another funny one that I like to share, just so you know, I never want to live in some vegetative state dependent on some machine. If that ever happens, just unplug me, okay? And of course, she's unplugging the TV. So what is advanced care planning? It's an ongoing process. It's thinking about, it's talking about, it's writing down and sharing your healthcare wishes. Why is it important? Well, especially right now, COVID-19 has kind of changed the way care is being provided out there in the facilities. And we want to make sure that you have that understanding. But also, no one knows when they're going to get ill, right? We don't necessarily plan for that. Who's a dementia planner? This is the kind of work that we do in case something happens. But this is really a gift for your loved ones because what it does is it eases the burden for others to have to make tough decisions on your behalf. So when it's hurricane season, what do? We do something, right? You go to Costco's, fill up on gas, maybe pick up water, maybe refill your prescriptions. We do something. So why don't we do something in preparation for our own mortality? Last time I checked, mortality rate is still at 100%. So nobody gets out of here alive. So why don't we plan and do things for ourselves? So the first tool that I'd like to share with you, it comes from the Conversation Project. And the Conversation Project was created by Pulitzer Prize-winning writer Ellen Goodman. This is a picture of her mom, and she had had wonderful conversations with her mom throughout life. But when mom was diagnosed with early onset dementia, she realized that she hadn't talked about her wishes for care. So she developed this tool through the Institute for Healthcare Improvement and developed the Conversation Project. And so the Conversation Project is a public engagement campaign, and it's dedicated to assure that everyone's wishes for end-of-life care are expressed and respected. So, have you ever thought about where you want to die? Well, the Conversation Project actually did a survey, and 70% of people say that they want to die at home. However, 70% of people are still dying in the hospital. So there's some sort of disconnect going on. Why aren't they getting what they want? 80% of people think that these are important conversations to be had with their doctors. However, in the state of Massachusetts, only 17% of people actually had these conversations. In the state of California, only 7% of people had these conversations. But 90% of people think that these are important conversations to be had. Here in Hawaii, we did a survey a few years ago, and it was self-reported that 30% of the people actually had these conversations with their doctors. So while we're ahead of the game, there's still room for improvement, right? So I want to take you through the conversation starter kit. And this kit, we want you to, when you do this, think about right here, right now, what are your answers? So the conversation starter kit has a bunch of different tools that are available from their website. It's free. They have different starter kits for people with dementia. They have starter kits on how to choose an agent and how to be an agent. They have how to talk to your doctor. They even have a kit for pediatrics, illness, children who have pediatric illnesses. So I'm not afraid of death, but I'm in no hurry to die. That's a great quote from Stephen Hawking. But we need to talk about this, right? We need to have these conversations. So the conversation starts with you. Woody Allen also has a great quotation. It's, "I'm not afraid of death, I just don't want to be there when it happens." And I'm with Woody on that one. So the starter kit, as we prepare to do it, what I want you to do is take a moment and just recognize that this is important subject matter. So it can be hard to wrap your mind around when you're doing this. But when you do this, what you really want to consider is what matters most to you. What are the things in your life that matters most? So when we finish this sentence, what matters to me at the end of life is, we have an idea of what's important to us. Now, these are answers that were given by the people that the Conversation Project surveyed. And if you'll take a really good look, the largest one there is peaceful. What matters most to me at the end of life is that they want it to be peaceful, comfortable, with family and friends. These are all positive experiences that people share. For the most part, people want to have a positive experience at the end of life. And this is the best that they can decide, how do we do that? What's the most important thing for you? Some responses that were given: what matters to me at the end of life is I want to say goodbye to everyone I love, have one last look at the ocean, listen to some 90s music, and go. Well, although you may change the 90s music part of it, the rest of that sounds pretty cool, doesn't it? It sounds very peaceful. Another response was having my sheets untucked around my feet. I like to bring this one up because my mom, who you'll hear about throughout my presentations, Mom had found herself in the ICU, and in the ICU, the nurses would come in and they'd tuck her feet in. And so she'd spend the next 10 minutes kicking her feet out because she just didn't want her feet to be tucked in. I finally put up a sign behind her and said, "Please don't tuck my sheets in. I like my feet uncovered." The nurses appreciated knowing that, and Mom was very happy to not have to spend 10 minutes kicking her feet out. And so the starter kit is 9 questions. 9 simple questions. There's no right or wrong. There's just your answers. These are some answers. For example, as a patient, I'd like to know only the basics about my condition and my treatment, or all the way on the other side, and it says all the details about my condition and my treatment. And you can be anywhere in the middle. These 9 questions are really helpful to see what kind of care you want and how you want your care provided. I like to share this story. I have a friend who, her sister was diagnosed with stage 4 cancer, which is terminal cancer. When she was diagnosed, she's actually a nurse. And as a nurse, she saw things and she knew what she wanted and exactly what she did not want. And the family was in turmoil. The daughter wanted her to try these treatments. The sister wanted her to try treatments. Her mom wanted her to try treatments, and she just didn't want to do it. So my friend called me up and asked, "What can I do?" I gave her the copy of the starter kit. And I told her, I said, as a family, sit down and everyone share your answers. Just share your answers. She called me up the next day and she said that was the best 2-hour conversation her family had had in the last 6 months. Because of this, I really call this tool a relationship builder, a means of getting to know your loved ones better and giving them the opportunity to know your desires. So I really encourage you to try the starter kit and share your answers with the loved ones. The people who are going to show up, those are the people who should know your answers. So who do you want to talk to? Who do you want to have this conversation with? Maybe it's adult children, maybe siblings, a spouse. Whomever you want to have the conversation with, I say have this conversation with whomever would show up for you. In a time of crisis, if you were in need, who would show up? These are the people who would benefit from knowing your answers. And have this conversation with all of them so that they all are on board with this. My ambassadors that I mentioned earlier, they will tell stories about fistfights in the ER parking lot because family members just don't know how to support each other because they've never had these conversations. So really, these conversations are a gift. They're such a gift that you can give your loved ones so that when they show up for a crisis, they know how to support you. And when's a good time to talk about this? Well, soon is not a time. Next Tuesday, that's an actual time. A couple of years ago, Reverend Rosemary Lloyd came to Honolulu from the Conversation Project, and she shared a story of one of her parishioners. In the month of November, she had actually done a series, an end-of-life series, and she was encouraging her parishioners to have these conversations. And so one of her members came up to her and was so excited and showed her her Thanksgiving invitation. And on the invitation, of course, there was the time, the date, and at the very end of it, it said, "There will be no pie until you tell me how you want to die." What a fabulous way to make this conversation non-threatening, right? We're just going to talk about it over some pie, enjoying time with each other on a wonderful Thanksgiving. So again, when would be a good time to talk? Think about that. And make sure when you decide when would be a good time to talk, that you tell the people who you're going to have this conversation what it's about. You don't want to surprise them, you don't want to worry them, but you want to give them a little bit of heads up so that they know what they're walking into. And of course, where are you comfortable having these conversations? It could be anywhere. I do have some people who say, I'd like to have these conversations going 65 miles an hour out to Waianae with the car locked and no way to get away because people just are hesitant to have these conversations. Wherever you're comfortable, this is what you want to do. So how do you start? Sometimes it's really hard to get into the conversation. Sometimes it's kind of awkward. I like to offer this suggestion. I need your help with something. I was listening to something from Kokua Mau, and they were talking about these conversations, and I really thought it was really interesting, and I'd like to share my answers with you. Would you help me with that? Human nature, we want to help each other, right? We want to take care of each other. So that's a nice way to offer that so it doesn't sound so scary. When you're having these conversations, you want to be sure you give current answers. You want to have more than one conversation. And you want to kind of really stay away from euphemisms. Pull the plug. What plug is that? What is a plug for? What are we using the plug for this? You also want to recognize that some people are just not comfortable with this subject matter. And it's okay to tell them that it's all right if you can't honor this. I just want you to know my wishes. It doesn't have to be serious. It can be very engaging. And it's also, we're not just talking about death, we're talking about living well all the way up until the time of death, which means you want to make sure that you share what matters most so that people can continue to honor your wishes by making sure whatever is important to you can stay with you all the way to the very end. Another tool that's available is our Go Wish cards. It's actually gowish.org. These cards are a great starting point if you're not sure what's important to you, or if you're not sure how to think about end-of-life issues. I encourage you to try their online version. It's free. The point of the game is to actually take these cards, and if you'll notice, it has different sayings on it. Take these cards and put them in ranking order. Most important, somewhat important, and not important. And the idea is to come up with the 10 most important things that you want to share with your loved ones. So for example, very important card says to have my family with me. My most important card is to keep my sense of humor. Go through the cards and take a look, because these are some ideas that maybe you haven't thought of. And I encourage you to share your answers. My husband, his uncle has some health issues, serious health issues that he's facing. And so I gave him the cards and I asked him to put out what was most important. I took a picture of the cards, I sent them to his sons, and his sons kind of laughed at me and they said, you know, that's great, but can you share that with mom? So I took it over to his wife, Auntie, and I said, Auntie, these are the things that Uncle said is most important to him. And she gave a funny look and she said, that's not important. That's not important. Why would he say that's important? What? I don't understand this. And I said, stop. These are the things that are important to him. And when she recognized that, oh, what's important to him is not necessarily what's important to her, there was a better understanding of how to support one another. So I do encourage you to go try the Go Wish cards and share your answers. This is the digital version, what it will look like when you're looking at it on a computer. You see the top 10 answers where you can actually look at it and figure it out. And you only have 10 slots for the top 10. So it is challenging to figure out what matters most. So when do we have these conversations? When's it important to start talking about these things? Well, you want to start talking about it early rather than waiting until an age. Start at high school. When the grandkids or kids are going off to college, that's a great time to open that conversation up. 18, that's the age of adulthood. And they also get HIPAA benefits, which will protect their privacy from that point on. So you want to have these conversations early. You want to have these conversations on a regular basis. And then when you have major life events, you want to have these conversations again. A marriage, a divorce, children, grandchildren, come back to these conversations and have them from time to time. I had a social worker actually approach me and said, thank you for reminding me how important this is, because on my documents, I named my ex-husband as my agent, and my new husband would not be happy with that. Go back and just review them from time to time. Make sure that the person that you choose and you trust is still the same and still able to be your advocate. And then if there's a diagnosis, you want to go ahead and do that conversation one more time. Your next steps, I challenge you, is to go into the conversation. Have the conversation with your loved ones. Talk about it. Share the starter kit answers. And just have that opportunity to give your loved ones the ability to know how to support you. Really, as I say, it's a gift. It's a gift to your loved ones that you want to be able to share with them. Because if the unexpected happened, who would speak for you? And would they know what you would want? Or possibly what you don't want? Would they know what to say for you, say on your behalf? We're going to have another session later on in the future, but in that meantime, I'm challenging you to do some homework. Determine who it is that you trust to speak on your behalf. Who is it that you are comfortable with having a voice for you if you're unable to have that voice? And we'll talk about what an advance directive is. And then we'll also talk about a post and who needs it and why it's really important. It's important to recognize that everyone over the age of 18 should have an advance directive. And that directive appoints your healthcare agent. That's the person you trust. That's the person that you want to speak on your behalf if you're unable to speak for yourself. Without designating that, precious time could be wasted where family is fighting with each other, trying to figure out who's in charge. Give your loved ones that gift so that when they show up for you, they're not trying to take control, they're not trying to take charge. It's already been done, and you've done it yourself. So without this, families can find themselves in guardianship cases. Guardianship can cost a lot of money, and it can take 6 months. So in the time where they're trying to figure out who's in charge, you could be in limbo, figuring out what to do during a health crisis. So really, consider who's important to you, who you trust to speak on your behalf, and try and have this conversation with them so that you're prepared to do the documents, which we'll talk about in another session. all your bases can be covered. Look at the adult decisions that we have to plan. It's great when kupuna come up to me and tell me, I've got my estate plan done. I'm so excited for them, and I'm sure their family is really happy about that. But something has to happen before you actually take advantage of those estate plans, right? So how about we make sure that you getting to that point is done the way you want? And that's where advanced care planning comes in. So some of our other resources, we have a mailing list for web newsletters. We have different tools available for you to download from Kokua Mau. If you have an organization, maybe a church, a book club, ladies club, we're happy to do these types of presentations via Zoom. We can do it on the internet and set that up for you folks. Feel free to reach out and talk story with us, because we'd love to be able to help you with this. These are the resources that we have available online. They've been translated into 10 different languages. And we really encourage people to take control of their healthcare decision making. Get as much information that you can on whatever decisions you're unsure about. So go ahead and do some homework, take the time to read it. We also want to tell you that you do have the opportunity to speak with your physician with regards to advanced care planning. You can actually request an appointment that focuses just on advanced care planning, and that would be the topic that you're talking about with your provider. And we encourage you to do this separate from your wellness visit or back to back with your wellness visit, so that your wellness visit is focusing on your wellness and your advanced care planning is focusing on your advanced care planning questions. If you have questions about any of the information that we've shared today, that I've shared today, feel free to take down this information. This is my contact information. Again, my name is Hope Young. I am the Advanced Care Planning Coordinator for Kokua Mau. The websites for the Conversation Project are listed here, as well as our website. We encourage you to take control and empower yourself with knowledge. So until our next meeting, I do appreciate the time you spent with me, and I encourage you to go out and have these conversations with your loved ones. Thank you.